Okay, so today's Monday, and I am on my way to my plastic surgeon's office. I used to find him to be, well, that hasn't changed. He was, during the whole cancer treatment and everything, he was the favorite appointments to go to because he was the only one who was not hurting me or giving me drugs that made me sick or giving me terrible statistics. And today, when I was getting ready to come over here, this was the first time I was like weary, because I'm like, I don't know what he's planning to do to me today. I have a feeling it's gonna hurt. What was I going to say? I have a tendency not to look at my wounds. I don't like looking at my body all, cut up and open, and I don't know. I don't like to see the inside of my body. Period. I don't like looking at open wounds and stuff like that. So, I looked at it the day that I saw that it opened. I sent him the picture and everything like that. But I wasn't looking at it anymore after that. And today, I kind of looked at it, and it's so hard to drive with one hand. I looked at it today and I was like, ill. Now, granted, I don't know what the fuck I'm looking at. Like, I am not a wound care specialist or anything like that. It's just, to me, it does not look pleasant. I'm like, I don't know what this is. Like, what is that black thing there? And I don't know. So with all of that, I'm very apprehensive about this appointment, but my window is so dirty from the pollen. We are here. I can show you his office. Let's give him some, what do you call it? Advertising. So with my dirty car window with all that pollen on it, we are at the Reconstructive surgeon's office. Yeah. Let's hope everything goes well. This windshield is like filthy with green pollen, but whatever. So, just left the plastic surgeon's office, and originally he was like, the wound definitely opened, gotta sew it back up. I frowned, but then he was like, the implant is exposed, and he was like 9 times out of 10, which I already read this, like when people were saying that their implants, their wound opened back up, that 9 times out of 10 that they lose the implant. So he was saying that the implant is exposed, and implants cannot be exposed. Like, the way they insert an implant is the special way to cut down on bacteria to prevent capillary contracture. Like, bacteria and inside your body is like a terrible thing. And once the implant is exposed to air, anything like that, the odds of capillary contraction go up tenfold. So he was saying that he was like, as opposed to putting you through more pain trying to sew it up and everything like that, I think we just need to get you into the OR and take it out. So yes, for all the people who were able to do an exchange surgery with breast implants after radiation. Consider yourself very lucky because some of us cannot. Some of us, our skin is extremely compromised and we cannot. So today is Monday. He was like, let's get you back into surgery on Wednesday. Mind you, I don't even think it's been 4 weeks since my actual exchange surgery. So then he's like, let your body rest, heal up a bit, and then we'll have to build the breast out of your latissimus dorsi muscle. So that's another surgery. So yeah, it sucks. It really, really sucks. I thought I was doing bad before with, 2 breasts that were slightly different sizes. Now I'm gonna have to walk around for a while with just one tit. As they take out this implant, I'm just gonna be completely flat on the other side. So I'm a little pissed off, so I don't want to talk right now. I'm done talking about it. So I guess I will just follow up with you guys like on Wednesday once they get this surgery scheduled and whatever have you. All right. Bye, guys.
Do your research. I'm not doing it for you. What are you doing?
About to record.
They wouldn't let me do it in
Yeah, you told me that they were extremely strict. I guess this hospital doesn't give a shit. I could probably record them and they wouldn't care.
They have a sign in the where we were that is prohibited.
Yeah, and they watch me record all the time. So we're back. I honestly don't know how many days it's been since the last surgery. What was the last surgery? On the 31st of January or something like that?
Was the day after mine? Yes. Mine was the 30th.
It was the day before.
It was the day after.
It was the day after? Okay. So yeah, the 31st. And we are, what's the date? The 27th of February. So less than 30 days. And we're back for another surgery. 2 needles this time. I am waiting for somebody to come in here and be like, oh, we need your blood. Because they didn't take blood. And I'm not saying shit. So I'm like, y'all are not sticking me again. The first needle, the vein blew. So I told her when she was starting, I was like, I only give out a 1 stick. A 1 stick minimum. So after that, when it blew, she was like, I'm sorry. I'm going to go get another nurse. I'm like, mm-hmm. So we have the IV going now. I have a migraine headache. It's probably a hunger headache. I tried to eat as late as possible last night. I ate at like 11:20. And then I was leery about that too, because I was like, if I'm eating this late, I'm like, I don't know if there's like a level of food you're supposed to eat. Like, you can't eat anything heavy. I ate dinner.
It wasn't.
At 11:20.
Why?
I had salmon, I had rice, I had broccoli.
Why did you eat so late?
Because I
have food.
I thought that would help me not be as hungry.
Nothing after midnight, that's fine. I have a steak potato. It's fucking 11:59 now. I'm going to take my last bite.
So that didn't work though.
No, because that's yesterday.
So I'm sitting here and I feel like I have a headache. And I'm thinking about all the things I could have eaten this morning for breakfast.
Well, I only had a turkey and cheese roll up or ham and cheese roll up.
Well, you had that.
Yeah, 6 o'clock in the morning while your ass is still in bed. Exactly. Although I wasn't tired coming over, which I was very surprised at.
Oh well, I'm hoping for no pain after this surgery. I think I'm again setting myself up for unrealistic results, but I feel like, my breast has been scooped completely out on my right side, so no nerve endings and stuff. I mean, I have a big hole in my chest right now, and it's not like I'm in excruciating pain, just get stabbing pains every now and then. So we shall see. I will follow up when I leave. So it is like after 11:30 at night, and I'm just getting around to updating. It was a super quick surgery. My friend said she went to the grocery store to get me some snacks for when I woke up, and by the time she was in checkout, the doctor was calling. Let me pause. I'm gonna get him to take off all this jewelry.
See, what do you do without me, huh? Yeah, feeding you, hey, what's going on here?
That's your job.
Nah.
Sorry for the interruption. So, yeah, the surgery itself wasn't a long one at all. I don't know. I mean, I know what was done. The implant was taken out. I don't know what anything looks like because I'm all bandaged up. I can't take the bandages off until I can't take the bandages off for 24 hours. So I won't be able to see until then. But what was I gonna say? I know that when I got out of surgery, I was in pain. What I didn't know is there is like this nationwide shortage of pain medication. So I don't know what they gave me. Like when I woke up, I had said that I was in pain. I was in a lot of pain, and they put something in my IV, which I would say was water.
There you go.
What's that?
Where's the flower for you?
You took that Valentine's thing apart.
It's a flower.
George brought me some flowers. There's some Valentine's Day candy out there that he dismantled. Oh, it even has a Hershey's Kisses. He's so silly. So anyway, my train of thought. They put something in my IV. It did not work at all. So I was telling the nurse I was still in pain. So she gave me a pill of hydrocodone, Tylenol. So the anesthesiologist had come back to my room to check on me, and I was like, she was asking me about pain. I was like, yes, I'm still in pain. So she said that she was going to order some Tramadine. So she ordered that from the pharmacy. That got sent up. They put that in the IV. Nothing. They took me back to my pre-op room or post-op at this point, where you kind of rest up. Your family can come back, and when you're ready, you can go home. So my friend, she was back there with me, and I was like, know when you're in pain, you want to walk around or something like that, but I can't walk around. So I was just like moving my leg and moving my hand, just trying to deal with the pain. And I was trying to talk to her, but at the same time, like tears were rolling down my face from the pain. So then she kind of got annoyed and buzzed. She buzzed in the nurse. I was like, is there something that you can give for the pain? So then that's when they started saying that there was this nationwide shortage of fentanyl. Because I was like, what do you guys normally give me? Because if I'm in pain, y'all will give me something and they'll knock the pain out. And she's like, yeah, we usually give you fentanyl, but there's this shortage of it. So she was saying how they were supposed to give me a pain pill before I went into surgery that was supposed to help alleviate pain when I came out. And I'm like, they did not give me anything before surgery. All they gave me was antibiotics. So she went and got some fentanyl from somewhere, and as soon as she put it in the IV, the pain was gone. Like, as soon as she pumped it in the IV, I was like, all right, I'm ready to go. Like, all right. So I thought that was interesting. It seems the more they talked about it, like there's a whole nationwide shortage on all types of pain medication. So I don't know if that's because a lot of the stuff, I don't know. I'm not going to guess. I was thinking that maybe a lot of it was made in Puerto Rico, produced in Puerto Rico, and because of Irma and all the problems that they're having there, that there's just a shortage. But I don't know, so I'm not going to guess. As soon as I got up, I was sick. So but this time it was like easier because my friend, she bought me like beef jerky and all of this stuff that I was able to snack on while I was in the hospital in recovery. So when I stood up is when you get lightheaded and I feel nauseous and everything. So when I was getting dressed, they had brought me a bucket because they know that I get really nauseous. So I like immediately threw up then, but it was much easier because before, every time I would throw up, there would be absolutely nothing in my stomach. So there would be a lot of heaving, and then, eventually I would just bring up bile and just like all the white fluid, not white, but clear fluids that they would have pumped into me, like medication and stuff like that. So that was always difficult this time because I had ate like a bunch of beef jerky and I was drinking ginger ale and stuff. I threw up, but it was so easy to bring it up because I guess it was right there on my stomach. So I did that before I left, and they wheeled me out when I left, and I got in a car, and to drive home, I think I threw up like twice. And by the time I got home, I got my little throw up bucket next to me, but I don't think I threw up anymore after that because I didn't eat anymore either. And then I was so tired. I had such a headache, and I don't know if it was a cocktail of drugs that they had given me or whatever, but I had a headache, and I went to sleep, and I just recently woke up not too long ago. George woke me up to make me eat something, so he had made me a soup, and he tried to give me a sandwich, but I didn't eat it, and I had to take my regular medication anyway. And then he just brought me some applesauce that I ate, and now I actually want some ice cream. I have some Tahitian vanilla ice cream in there that I'm thinking about calling him so he can bring me that ice cream. But I don't know. But anyway, I survived surgery. I am completely flat on this side now. What I did notice is I don't have the discomfort that I had like ever since my tissue expander was placed, and then even when the implant was placed, there was this constant discomfort on my chest where my muscles were like stretched across it. My pectoral muscles, it would like never relax, it would just stay tight. And then there was a muscle on like my side that was just always painful, and I'm noticing I have none of that discomfort now. It actually feels normal, like both sides just feel fine, which I always thought was, which I think is interesting because my right side, my left side, there is an implant in there and it is also under the muscle, but I don't have that tightness that I always had on my right side. So, I'm just going to be flat for a while. I really have to wrap my mind around this latissimus flat surgery. It's just a lot. I haven't even thought about what I'm going to do about like a prosthetic or something like that. So I'll think about that at a little later date. Trying to think, is there anything else? Nothing else right now. I have a follow up. I have to follow up with my plastic surgeon in a week. And that's pretty much it. For again, all the people that can go and get their exchange surgery and get implants and it's perfectly fine. That is not all of us. Implants after radiation have a very low success rate, but I was just hoping that I would be the exception, but I wasn't. So unfortunately, again, I'm not a candidate for a lot of the surgeries. I can't do a fat transfer. I can't do the deep flap surgery because part of the deep flap is to transfer like stomach tissue, muscle, and fat, and I don't have the fat, so not a candidate for that. The tram flap, I don't know why I can't do that one. Like my only option is the latissimus dorsi flap, and that's just a lot to take in. And right now I've had 2 surgeries in less than 30 days, so I'm really just not thinking about a surgery right now. But I'm still young. I'm not married to anyone. Like, if I was 70, there's a lot of older women who are like, yeah, I don't care about having breasts. So it's like, oh, take them and don't give me anything back. And I'm just like, I'm not there yet. Like, I still like to wear pretty dresses. And again, I'm not married to anybody. So there's always a possibility that I'd have to start dating again, and I don't know. But I'm rambling. This video is long, so I'll end it here, and I'll catch up with you guys with my 1 week follow up. All right, bye guys. So I am at the plastic surgeon's office doing 1 week post-surgical follow-up. It's been a week of one breast. Has been interesting, to say the least, trying to get dressed in the morning. I think I'm going to look into getting like a prosthesis or something, because it's just weird and very lopsided. Your clothes just hang really weird. But he's probably gonna take out the stitches, and I'll be back with whatever he tells me. So it was a whole, I hate that my eye had teared up and the eyeliner got up here and it looks terrible. But anyway. What you looking for?
A little bottle.
Of hand sanitizer?
Why is it in your bag?
This is my bottle of hand sanitizer.
No, it's not. I have the
Yes,
one
it
I
is.
put in this car.
This one's mine, I think. I'm sure.
No, this is mine.
Okay, well, whatever.
I don't believe it. Where's the other one at? I had one. I filled it up at work.
So he essentially took out 2 stitches, and then my nails look terrible. I'm sorry. I need to get nail polish remover. The whole house, I don't have any. He took out 2 stitches and then said, "I'll see you next week." So didn't really get much of anything from this appointment. He just pretty much said, "Hang in there." I asked him if I could wear a bra. He said yes. So I'm gonna go right now to try to find a bra so that I can at least stuff the other side so that I don't look so lopsided. But that's all.